This is our first live chat, and we are live from the Bay Area Pain and Wellness Center in Los Gatos, California. I'm Dr. Peter Abaci, editor for Pain Relief Revolution, and it's a pleasure to be with you here today. What, why do we have this? Why are we here today? And why did we create Pain Relief Revolution? Well, I think we created it for you, and I think you want better, you deserve better from healthcare, and probably what you're struggling with or trying to do to better manage your pain, or you're here for your family members and loved ones. And we wanted to create a go-to source, a resource for you where you would get honest answers, you would get unbiased opinions, where you get up-to-date information on all things managing pain. And we wanted to provide that for you. It's Pain Awareness Month, and this is a time for change and a time to transform healthcare. And we want to help be a part of that with
So, my name is John Massey. With Peter, we're both practicing anesthesiologists who have been working in pain management full time since about 1996. We have seen a lot of changes. This was an opportunity for us, as Peter was saying, to really talk about our truths, what we have seen after treating literally thousands and thousands of patients. The opportunity to provide service to you, to answer your questions, to give you good, timely information that hopefully you will find very helpful in your own personal health care. Peter and I, we were interns together a long time ago in a county hospital where we met. We were both going to be anesthesiologists, and at that time, pain management was literally a very new field in medicine.
and we had no gray hair back then, by the way. Just disclaimer.
And honestly, I never thought about being a chronic pain management physician. And it wasn't until I was well into my residency at Stanford that I got interested in what became my life's work. And it was just serendipitously that Peter and I had life paths that crossed just after our training that allowed us to begin building what became a leading pain center, certainly in the nation and obviously in the West Coast. And so we currently treat every day. We're real doctors. We spend all of our time treating patients. It's a treat for us to get out of the clinic and talk to you guys about real life stuff.
It's interesting. You talk about why did we go into this specialty, and someone was talking to us about that the other day. And I told them that, when I was doing my anesthesia training and I had a little experience rotating through pain management, and what a great feeling it was, and how misled I was, where I'd walk in a room, do a procedure, do something, and immediately a person would feel nothing. And I thought that, the pain would go away immediately, and I thought, wow, what a great specialty. This would be a great thing to do. And it was only later, that I started to understand that I really wasn't helping anybody that way, and that true healing, true recovery, real pain relief is really a much more deeper, complex process for the person, and that you really have to follow people on a long-term basis to really see what their lives are like and how different treatments or interventions really impact them on a long-term basis.
So, Pete's a scientist, and I'm somewhat of his backup. Sometimes I might say things that are off color, and I mean them not to be derogatory at all, but to just really give you real information and real answers. Like I say, I'm a practicing physician. I'm not a TV personality. But I do believe that getting information from a real treating physician can be helpful.
Let's start talking about some questions and answers. We have first question is from Amelia, and Amelia writes in, "What is good for knee pain relief?"
Peter, you got this one.
Wow, that couldn't have been a better first question, because I personally actually have had a long love affair with my own knee pain. I've had a history of bad knee injuries going back a number of years, and I went through a life-changing experience. And actually, what I learned from being the patient with the knee problem and the chronic pain really became a life career-changing experience for me and helped me become a much better doctor. And I'll tell you a couple things that I learned along the way. So, first of all, with knees don't like to be stuck in a fixed position for very long. So you have to stay active and you have to exercise. You got to be strong. So you need to find a good daily program for yourself. Now, I'll tell you a couple things that I did and I went through a process because it's really hard to get started. And I found myself, struggling with that. I gained weight, my cholesterol went high a lot. Once you start hurting somewhere, everything goes haywire throughout your whole body. And so I can appreciate that a little bit. I think that I got real interested in Pilates after some of my reconstructive knee surgeries when I was having a hard time functioning well, and I found that to be a great sort of transition exercise from physical therapy into more real life exercise. And I found Pilates to be a real great help, and I did that regularly for several years. Then, as I started to progress with what I was doing, I discovered yoga, and I really attribute yoga with improving my knee pain on a day-to-day basis, maybe more than anything. Obviously you have to be careful. Not every pose in yoga is knee friendly, but the movements, the poses, and the breathing, and the mind-body connection it creates was turned out to be a really great tool. And I try to do yoga, a couple times a week. Um, Another thing I found helpful is your body weight matters, and just even an extra 5 or 10 pounds puts a significant amount of extra stress on joints like the knee. And so I think just even a small change in body weight, if you happen to be um, above ideal body weight, can really be impactful. So that involves making diet changes, nutrition choices. It becomes a whole lifestyle thing. And so I found that to be a way to help me in the last 10 years have a much better handle on knee pain.
I want to just add one thing to that because I watched him. I was his partner during this process, and Peter will be the first one to tell you that there is not a pain medicine on the planet that manages knee pain, and that includes Vicodin, Norco, oxycodone, even Dilaudid. Very, very strong opioids. They really do not manage knee pain, nor are they help you to stay on for this problem.
So I wonder if we can scroll down on this.
Well, he wants to know how can chronic pain sufferers help their families help them. And here we actually embrace the family because we realize that the pain that exists doesn't just involve the individual, but it involves the dynamic of everyone in your life. It's an experience that you wake up with, that you have all day long, that you go to bed with, that interacts with your loved ones, your mate. And one of the things we do here is we teach communication styles. We have cognitive behavioral therapists that are very into teaching patients how to interact. It's not an innate skill. It really is something that needs to be taught. We also provide family group therapy here. We're bringing patients who are being in treatment here. We're bringing their families and explaining to the families what treatments they're going.
And a couple of things that we've talked about or written about in the past, family dynamic situation, because it is a really important topic. For example, let's say you've been injured and your family member, your husband or spouse or wife may respond or react to you in a certain way, and you start to improve or get better with the treatments or strategies that you've been working on. And that person may be looking at you as the patient or the injured one. And while you're trying to get better and progress, that relationship, that dynamics, maybe that needs to change. And maybe they need to back off, helping you less, letting you do more things, letting you become more independent. There needs to be some types of communication, because your family wants to help you. They want to do what they can. At the same time, you have to communicate well so that doesn't keep you from getting better when things start to improve. And that's just one example of how the family dynamics affect each individual's
That's a good question because actually that's a much deeper topic that we could go on and on about. We're going to have a lot of questions today, and we're going to move through these individually. So I encourage you to keep asking, and we'll keep moving on.
We have a question from Katja, and it's a great question. How does stress aggravate chronic pain? Maybe I'll start with that. Think about stress. Think about the fight or flight response. Remember or imagine when you're driving a car and all of a sudden somebody in front of you stops, they hit their brakes, and you got to hit your brakes right away so you don't hit the car in front of you. And you can kind of visualize or imagine that sort of surge of adrenaline that goes through your body, your heart's pounding. What you go through immediately is called fight or flight response. Now imagine that sort of stress reaction going on for months or years. And that's what can happen to people when they're in chronic pain. It becomes a stress on our system, and it creates this sort of constant sort of surge of adrenaline, fight or flight, this overreactivity, overexcitation of our nervous system. And part of effective pain management, part of overcoming chronic pain problems, is learning how to the right tools and techniques to better manage stress, because that ultimately it turns down the volume on your pain. So it's a really great question.
Well, you're looking at two anesthesiologists, and it just goes to show you how the field has changed. Because we used to think about managing all of this with either a medication or an injection, and now to be looking at the primary questions we're getting is how can we interact with our families and how does stress affect my pain. It really goes to show you how this field is evolving into more of a wellness-based field. And the whole concept of stress and pain, while it's important, the whole stress issue is really more about your general health. There was an article this week that talked about prostate cancer, and people who were practicing meditation and stress management with a vegetarian diet actually had resolution of their cancer and actually had an elongation of their telomeres, indicating longer life. And so just in terms of your general health, the stress response is completely offsetting to your whole internal milieu.
And he says I'm a scientist. Listen to that. He's talking about telomeres with you. It's great. Well, I think stress is sort of a common link between many chronic diseases, right? What you say. And with pain, we often talk to patients about, imagine like you're listening to, like radio or music, and your stress levels is like turning up the volume up or down on your pain. When your stress is out of control, then it's like turning the volume really high on your pain. You start to feel a more intense level of pain. Learning how to manage stress is a way of sort of dialing down that intensity of pain.
Well, Dorothy wants to know what the link between chronic pain and inflammation is. And it's very similar to what we're talking about. Stress leads to cortisol levels. Increased cortisol levels, you're talking about cytokines and increased pro-inflammatories that actually cause immune problems and inflammatory reactions system-wide. And you end up treating all the secondary issues that were originally pain caused, now stress caused. And so the interaction is huge.
And to your point there with we were talking about the stress, the pain, the inflammation. So as Dr. Massey was saying, cortisol levels go up when you're stressed for a long time. It creates this inflammatory environment around our bodies and our brain and our nerve cells. And we know that too much cortisol is toxic to the brain. Some interesting studies done on brain research shows, for example, people with chronic back pain, they start to see sort of accelerated aging changes of the brain, the sort of toxic effect that the pain and stress and the cortisol levels in the sort of negative toxic environment that can create, how it can directly affect our brain function, our health, and why good stress management is so critical, why a good anti-inflammatory diet is helpful. Some of these things are important. We got more questions coming in. We got Jill writes in, my boyfriend has been suffering from chronic pain for about 2 years. He's seen a number of specialists in search of diagnosis. He's had little success. My concern is that his condition is
getting worse.
Okay.
Well, what if I told you that when patients come into the clinic, that's a very common circumstance. They come in with a pile of medical records, all these diagnostic tests. They'll often come in with a bag of different medications and a whole litany of failed therapies. It gets very frustrating for us because we always feel like we're the last person to see the patient when we always feel like we should be the first. But in terms of diagnosing pain, the medical community really has it wrong because they look at where does the pain come from? What's the generator of the pain? And I'm telling you that you can't look at an MRI or a CT scan and say, this is where your pain is, and therefore we're going to inject it or make it numb, and therefore it's going to be fixed. And you have to realize your pain is an experience, and it's something that we can't measure, and we really don't know where pain comes from. The research associated with identifying where pain comes from or how it's processed is in its infancy, but it's growing. So what we start with is looking at the patient. It's more important to treat the patient who has the disease than the disease itself.
And, I often tell patients the same thing, or even when I'm writing on WebMD, I treat patients, I don't treat illness. And I think that, we get wrapped around some of these tests and things, and it doesn't really tell you what's really going on with the person. And, pain, there are many layers to pain. It's very anxiety provoking. The person in pain, they don't know what's going on. There's not a real hard diagnosis, to label something with. And that creates a lot of anxiety, and it probably makes the pain, worse because of that. And it's difficult to be in those shoes. It's hard to be in pain and not know exactly why. But, the reality is we don't know everything in science and medicine. And sometimes we think we do when we really don't. And, we have to, at the end of the day, manage the pain that we have today, make it the best day we can, use the tools that seem to work the best for us, and have the best day we possibly can with whatever challenges may be in front of us.
And, honestly, you have to be okay with when your doctor says he or she doesn't know. But at the same time, I would give you a different way of looking at it. In other words, we certainly want to make sure nothing dangerous is going on, and we would certainly rule out anything dangerous that we can treat. And that's what we do. But in terms of, let's say that there's a pain problem that we don't know what it is, and we don't specifically have a cure for it, which is most of the time, I can tell people all the time that they can have this problem and still be perfectly healthy. Or they can have this problem and still have a bitch in life. But we have to come up with a plan that allows that to happen.
And, a lot of times, when you've got a pain problem, you don't know really what it is. At the end of the day, your behavioral, your lifestyle changes, being healthy, doing all the things that make you healthy and well, is going to help you overcome whatever challenges or pain might be, even if you don't know exactly what the cause is. We've got some more questions coming in. Katja comes back to us, thanking us for our first answer now with another great question. This comes up a lot. Do you have any dietary tips to ease chronic pain? I think we both do. We both have our dietary strategies. Shall I go first?
Please go ahead. He's much more healthy than I am.
It's not true, but I think looking at some things that I did when I was talking about some of my knee problems before, some of the dietary changes that helped me. I was looking at what was I doing wrong before. Well, I think we have a tendency to not eat a good breakfast. The old adage that breakfast is the most important meal of the day. It's absolutely true. It has a big impact on your glucose levels the rest of the day, how you function the rest of the day. And people who eat a bigger breakfast actually are less likely to be overweight or obese. So we know that that's important. And then throughout the day, there's a lot of research that suggests smaller meals during the day helps keep but glucose levels at a more steady state. Why is that important? Well, it's less of an it's less inflammation for your system when your glucose is more steady. Swings in glucose from starchy foods, trans fats, things like that increase inflammation, cause all the problems we were talking about earlier with brain, accelerated aging, and all the things that we don't want. At the same time, there's so many great nutrition choices to bring down inflammation. Fish oils, omega fatty acids to eating fish like salmon. The whole produce section, the grocery store. If you go grocery shopping and you just stay in the produce section and then come home, you can be in good shape probably. We could probably have a 2 hour lecture on nutrition and how critical that is to good health and good being.
Well, the biggest issue, or one of the biggest issues affecting our country today is obesity. And the obesity is the direct result of the way we get our food and the types of food that are available to us to eat. Most people don't cook meals anymore, honestly. Most of the patients who come in here eat processed foods, and that's just what they either can afford or have the strength to use, and it's a battle. And so we can give patients education, but changing their habits takes time, energy, and commitment.
Well said. We have a great question from Amelia. She said that we're correct regarding pain medications. They truly do not work. I'm trying to avoid surgery and have been reading about apostherapy. Are you familiar with this procedure?
I'm not, but I'll tell you what, we would be happy to answer your question. Email us at painreliefrevolutions.com and we will get right back to you for an answer. There is a statement there that I want to bring up. This is a very important statement. We are not anti-medication at all. We use medications in this clinic every day. I would just preface it by saying we're pro-health, not anti-medication. Patients take medications, and we use medications if they're healthy for the patient to remain on. So I don't want you to think that just to say no to meds, because that's really not reasonable. And I would tell you, by and large, every patient who comes in here is usually taking something. I think it's important that we try to reduce the amount of medications and promote someone's general well-being and health. But there are indications for things and contraindications for things.
And I would add to that. I agree with that. And one thing that I like to tell patients is think of your body as a temple. You honor what you put in. And everything you put in it is important, whether it's air you breathe, the water you drink, food you eat, or medications that go in your system. And it's important to think carefully about that. I think a lot of times doctors are too quick to write a prescription or recommend something, and really take the time to really look at, hey, how important is this? What are the side effects? What are the benefits to the person? Honor everything that you put in the body with the temple that it really is. And I think another great question when you're talking to your own doctors, when they recommend a medication or a surgery or whatever it is, say, hey, if I was your spouse or your son or daughter, your father, is that what you would recommend, for me? If you were in my shoes, would you want to be taking that medication? Would you have that treatment? And the answer's not yes. You have to kind of wonder, why are you recommending that for me? And I think we need to take a hard look at what we're doing in this country and how we're treating people and what we're offering people to help them manage their pain better. Maybe I should stop.
Well, no, Amelia was asking for the email address again. It's painreliefrevolution.com. Great question coming up. Sharon says, I don't want to take strong pain meds for my back pain, but that's all that helps now. I used to work out all the time. And I'm not overweight. What meds would give me better relief than hydrocodone? Well, the answer is I don't know. It would really depend on the individual. There are a lot of different therapies that we use. Honestly, it's a balanced approach that you want to have. It would take a very good assessment by a pain physician that incorporates not only the specific problem that you have in your back, but also your lifestyle, what your goals are, what your activity levels need to be. But there is no specific medicine that I'm going to tell you that works for everybody.
I think if we were going to discuss some sort of traditional options, just to give medication a little bit of discussion in today's talk, there's in pain management, we sort of divide pain up into different categories. There's pain that's more nerve pain, there's pain that's more arthritic pain, there's musculoskeletal pain. So there's different types of pain. Sometimes the types of medications that your doctor might recommend, or maybe vary depending on what they think the type of pain might be. Back pain is very complicated because you can have all components of all of those things. For example, a nerve pain medication, or what we call anti-neuropathics. There's a whole family of those, like Nerlontin or gabapentin, the generic name, Lyrica, medications that go in that family. Maybe you've tried some of those options in the past, but there's many different categories depending on what your doctors think might be some of the causes of the back pain that you have. But at the end of the day, if you're somebody who likes to exercise, I think exercise is a great way to help manage pain if it's done right. Research has actually shown walking to help back pain more than any form of exercise. And just starting a daily walking program can be a great part of starting a great long-term back management program.
Well, the only thing I would add is the fallacy is to think that stronger narcotics will give you a healthier, happier life. And I'm telling you that having done this for years and years and years, it doesn't work out that way. You end up more and more dependent with fewer results. It's only a matter of time before your body will accommodate to whatever dose of opioid you give it, and you end up looking at it in several months saying, now this isn't working, what's the next step? So the one caveat I would tell you is simply escalating your opioid use is not a safe way.
And for those of you who are wondering, how can you email questions? If you want to have your questions answered in private, you can email them to us at support@painreliefrevolution.com. If you have questions that you want to share with everybody and have everybody benefit maybe from the discussion on, you can go to our Facebook page, facebook.com painreliefrevolution, and we can discuss your questions that way. So you have two options there. I think Steve was asking what sort of unique things do we do here at the Bay Area Pain and Wellness Center. Man, we do a lot of stuff here. We keep our patients busy. You want to talk about what a day life can be like for a patient here?
Well, let me give you some background. So imagine two anesthesiologists, early adopters for pain management, coming out, being the only board-certified pain doctors in town, and beginning a clinic. And back in the 90s, what we did is we did injections, blocks, and we used medications. We would prescribe physical therapy. We would prescribe some psychology. What that has really changed into is a much more balanced approach where we do thorough assessments, medically, in terms of their rehabilitation potential, what's broken, what can be fixed. Also, their psychological profiles, how is the patient's sleep, mood, their family dynamics, and then most importantly, balancing all that with what the patient's goals are. Are their goals to be able to go out and hang with their family to find the dinner, the movie? Is it that they want to return to exercise? Is it that they want to return to some type of gainful employment? It really depends on what the patient wants to do, and then we start making a plan. And that plan is individualized. And it can range from anything from some outpatient care to a pretty intensive rehabilitation program.
Let's suppose you come in to the clinic and you want to know, you want to talk to the doctor, you want to present your problems. What's the best way to communicate, with you as a patient so that you get all that information and know what all your best options are? As a patient, I think patients are always looking at getting better communication, with their doctors. They often feel like their doctors don't have enough time to spend with them. There's usually a lot of things that they want to discuss about how they're doing. What are some tips, Dr. Massey, on better communication with the doctor?
The biggest thing I can tell patients is, number one, you have to feel the doctor believes you. And then secondarily, you can't overload them with your whole story all at once, because universally, patients who have been suffering with pain for quite a while have a lot of failed therapies and a lot of trauma. And trying to get someone's trauma across in a consultation beyond just the basic background is difficult. If you have three things that you can direct that are very important to you to put across that day, I would really try to limit it to 3 basic things that you want to accomplish, and then build a relationship and build your plan from there.
Great. Justin writes in, doctors, I just take 2 leave every day to ease my back pain. Is it safe? And heard there's now a cost for prostate cancer.
That's news to me on the prostate cancer. I'd have to look it up. However, do I think taking 2 leave every day is safe for your back pain? Yes. It's over the counter. It's easily tolerated. The biggest risks are that you get some dyspepsia with your stomach or some long-term kidney disease. Does that happen a lot? No. In the clinic here, we test patients' liver and kidney function either bi-yearly or yearly. We work with their primary care doctors also to make sure that their medications are safe and effective for them. Really, again, it's about, if you're going to take medicines, they have to be helpful for you.
Let's talk a little bit about some other commonly asked questions and things that people seem to be struggling with. For example, we know that there's a big new healthcare law, that everybody's still debating on, but it's been passed. We call it Obamacare, Affordable Care Act. Maybe we can talk a little bit about, the world of insurance, politics of pain management, the economics of pain management, and what the future is holding for people who are trying to get relief and get better.
Well, this is a huge topic, and it can get very controversial. You have to realize that we have changed our practice over time, and we are not perfect, but at the same time, I can tell you that most pain management practice in the country is financially based. In other words, this is a true story. When you go to the doctor, the first thing your doctor typically looks at is what kind of insurance you have. And from there, the doctor figures out what resources they can use or what they're going to be doing for you. And often that means a lot of procedures. And that's just historically the way the field has developed. It's not right, it's not good, and it's not healthy. And that's one of the major things that Peter and I are trying to change. How this healthcare plan is going to affect the field of pain management, I don't know yet. I just know, here's the issue. The issue is chronic pain is the most common disease in this country. It is more common than diabetes and high blood pressure. The idea that we are going to come up with a unified way of treating everyone, I find it hard to believe. I want to see it work, but at the same time, it's always going to come down to doctors and patients having a good relationship and being able to communicate and maintaining good health.
Suppose we're at home right now and you've got a chronic pain problem, you don't have insurance. What do you do? How do you succeed in that situation?
Well, you'd have to be very self-reliant. How would you have access to medications? How would you have access to any of the therapies that we would typically use for diagnostic studies or procedures? You wouldn't. You're left with your own vices, but at the same time, with the internet, the amount of information that is available for you to become more of an expert for your own healthcare, the opportunities are there, and you really have to be your own advocate.
Yes, learning how to find the right information on the internet, different resources, and learning things that you can do, that's valuable and challenging. And I think what we try to help patients learn how to do is develop their own program for themselves. Develop your own system, your own program to work for yourself and be consistent with it. Be disciplined. Practice it every day, whatever the treatments are, the modalities are that work for you, that you can do, can be, I think, very empowering and hopefully even without insurance.
Well, successful. The first thing that happens when you suffer a major injury is what? You can't work. And then you can't work, you don't have money. There are disability funds available if you qualify for them. But the economics of pain is I lose my job, I lose my insurance, I lose my car, I lose my house. We have patients in here every day that are literally payment to payment away from being residents. It's sad, and you talk about stressful. trying to worry about your health care when you're really worried about building the shelter, it's just kind of puts things in perspective.
As a reminder, we have about 15 minutes left, and these have been some really great questions. Um, Maybe this would be a good time to talk about, a lot of people with pain are often talking to their doctors about surgery, making decisions about surgery as a way of alleviating maybe some sort of chronic pain problem. We certainly see patients every day who are trying to figure out what to do, and certainly when you have a problem and you see 3 or 4 different doctors, you often get 3 or 4 different recommendations or perspectives, and invariably one of them might be, hey, should I have surgery for this problem? Gosh, can somebody please fix this damn problem for me? What about some advice, for people who are trying to decide, what decisions to make with things like surgery?
I give you the biggest one. The most common diagnosis treated in this large clinic is something called lumbar post-laminectomy syndrome, or lumbar post-fusion syndrome, or failed back syndrome. People who have had back surgeries that have quote-unquote failed. And it's sad because most of the time the surgeon says, well, the surgery was a success, the patient failed. And that is just so far from the truth. I would state that patients are often led down the wrong path. And there's 2 big indications for lumbar surgery, and they're rare. One is instability, where pieces in the back are moving and causing neurologic damage. And really the second big indication is profound neurologic damage that's getting worse. In other words, the surgery is going to save a limb, where a limb does not work. The most common reason people get or have back surgery is for back pain. And if you think going in and having an operation for back pain is going to make your back pain better, well, I'm going to tell you that the science does not support that at all. The outcomes are very, very poor.
At the same time, I think that there's a lot of progress being made in the joint replacement, realm of things, with hip replacements, knee replacements. We're starting to see new techniques, less invasive things. And I think for those with bad degenerative arthritis, in the knees or hips, I think we're seeing good progress being made, in surgical technique and surgical outcomes, that way. We have another question from Katja. Thank you for being so interactive with us today. What would you advise for parents whose children suffer from chronic pain? What can they do to help other medications to avoid?
Well, you got us on this one because we don't treat pediatric patients here. We actually have a relationship with Stanford, and the Stanford University Hospital has a pediatric pain center. It's a completely different animal because, believe it or not, you're treating the patient and the parent in a team. So I would defer to the pediatric pain specialist because I'm not.
I think it's good to bring up, though, when you're working with children, pain problems are very prevalent, actually, with children, and in particular, head injuries, as we know, has become a really big problem. We've not done a good job in the past in recognizing and treating head injuries with kids, and that's actually one of the most common pain problems, across the country, with teenagers and children, and we often have a tendency to overlook that. And it's important to keep in mind with kids, not only if they've had a concussion or a head injury, not only do they need to take a break and rest to recover from their sport, but they also need to take some time off from school. Brain needs a little bit of time to recover. So always, when in doubt, sit them out, as they say, for head injuries. So it's important to bring that up. Sharon has a question for us. What do you do when surgery and injections didn't work? You ever seen that happen?
That is probably one of the best questions that we've had. What if I told you that would be the most common reason that somebody would be referred to a center like this? Because literally we're the pain clinic for patients who've already been through a pain clinic. So the typical scenario is patient gets hurt, patient goes through acute care when they have their physical therapy or MRI. They may have had surgery, they have their surgery, they're still in pain, they have more physical therapy, they get sent to a pain management clinic, The pain management clinic goes through the injections and then says, well, we've done what we can do. And honestly, what if I told you that's the most common referral that we would have here?
This might be a good time to talk about injections a little bit because this is a hot topic, I think, in healthcare for a number of reasons. One is, some of you may have heard about the pharmacies, the compounding pharmacies where they had some really horrific side effect reactions from the cortisone medications that were made there. And then I know Dr. Oz has had some shows discussing things like epidural injections, and there's some controversy wrapped around that. Do they really help or not, or when do we use them?
And we do use them.
We do use them. And I think, it's important to understand where they fit in or what the context of where things like that might help. Because, not you can't, a hammer is not for everything. It's not the tool for everything. It seems as though things like epidural injections for back pain are more of a short-term treatment than a long-term treatment. For acute or subacute inflammatory problems, they seem to help calm that down. But at the same time, a more chronic back condition or neck condition, it's probably not going to be reversed long-term, with the use of injections.
But Sharon, I would also tell you that it's very common once you get into this situation that you're living month to month between doctor's appointments. Where you're going to the doctor the next month, you're getting a refill of your meds or a new medication or a new injection, and there's really no plan. And when you get to the place that you're describing where you've had the surgery and the injection, the doctor's looking at you saying, don't know what to do, that's a time to take a huge step back because that's exactly when you want to go all in. And what that means is you need a very good plan. And that's when we will actually spend a day with the patient and have them see something called an interdisciplinary evaluation where they see a physician who's been treating them, they see a physical therapist, they see a psychologist. We meet in a team fashion with all this data about how to get their plan going and what the goals are. And we actually put a whole package of care together that basically turns into a pain management program. Patients will come in here, for instance, 5 days a week, several hours a day, working with doctors and nurses and physical therapists and psychologists and wellness instructors and return to work specialists, life coaches, and over a period of time, restore function, restore their lives. And most of the time, patients actually come off a bunch, or not, if not all of their medications. And it's really a much more comprehensive approach to a much more difficult problem.
We have time for one more question. And as a reminder, you can please email us or Facebook us any questions that we didn't get to. Michelle would like to know, what do you do if you can't find a pain management doctor who will take Medicare, and this is your only option for getting meds that will help you with the kind of pain that you have? We spent a lot of time talking about medications, and I think, at the end of the day, medications can be helpful, and it sounds like it's been an important part of your particular management plan. But I think at the same time, there's so much more out there, from a medical treatment or non-traditional medical treatment perspective that you could explore that might help you, and maybe in the long run might be even much more successful than the medications that you've had. I think we found that there are a lot of healers out there. There are a lot of people out there who have a lot to offer people who are suffering or struggling with pain problems. And this might be an opportunity to kind of expand your approach to what you're looking for. And if not, you have to pay out of pocket to see the doctor for the medication.
Well, and I would actually look at the issue differently. It could be that the medications that you're on are scary to the physicians that are looking at your chart, and that maybe they don't want to take responsibility for writing, say, high doses of opioid-based medications. And for instance, we take Medicare here, and at the same time, I would encourage you to be open, and instead of being a patient who's coming in saying, I just need this and this is all I need, present yourself as a patient who is really looking for better health care, but by the way, these are the medicines I'm on. Do you have any other ideas? And I think you might get a very different answer from the clinics or physicians that you're seeing. I think it's more a defensive medicine from the clinics because they're just afraid of your meds.
It looks like we are out of time. This has been great. We've been honored to be able to talk with you, and these have been some great questions. Hopefully, we'll be able to do this again really soon. As a reminder, you can email private questions to us at support@painreliefrevolution.com. You can also type in your questions on our Facebook page. We look forward to answering anything like that we still have that we didn't get to. And have a great day.
Stay healthy.